Hi, so for my topic, I have chose autism spectrum disorder for my final. I believe this is a very important topic that affects so many children in the world today. Autism is a neurological developmental disability. It affects children and adults of any age, and it affects their ability to communicate and interact with others. And within the last 2 decades, the chances of having a child having autism spectrum disorder have increased dramatically. Some believe it's increased recognition in doctors as well as parents, caregivers, teachers, and grandparents, any other individual who works in childcare, works with children. Autism spectrum disorder, ASD, is referred to a broad range of conditions characterized by challenges with social skills, repetitive behaviors, speech, and nonverbal communications. According to the Centers for Disease Control, autism affects an estimated 1 in 54 children in the United States alone. That is a lot of children. The American Academy of Pediatrics has recommended screening for ASD at 18 and 24 months of age, but symptoms can start emerging much earlier than that, which is crazy to me. Yet still in many cases, a person does not recognize these signs and symptoms until adulthood. Once a child is diagnosed with autism, so many parents are very upset and wonder if they did something wrong, but they didn't. Research tells us that autism tends to run in families, and certain genes passed down to your child can increase the risk that the child will develop autism. Some of those risks can increase the chance of autism in your child are advanced parent age, doesn't matter what parent, if pregnancy, and even birth complications. Example is extreme prematurity before 26 weeks. And even autism can even be raised if pregnancies are spaced less than 1 year apart. A lot of families think that vaccine can cause autism, but this is proven not to be true. There are also different levels someone can be on the autism spectrum disorder. The levels can range from mild to severe symptoms. There are 3 levels of autism: level 1, level 2, and level 3. The levels are assigned to help identify severity of the symptoms in the domain of social skills as well as the domain of restrictive and repetitive behaviors. An article that I found very useful has taught me the different levels of autism. It was written by a woman named Heather Gilmore, MSW, an LLMSV, and a BCBA. The article she wrote was called Reflections of Applied Behavior Analysis. So basically, level 1 is the least severe of autism. People who have level 1 ASD may struggle in social situations and have repetitive behaviors. They may struggle to have some relationships and struggle to maintain conversation and even making friends. People with level 1 ASD prefer to stick to a routine and feel a little bit uncomfortable when things change in their schedule. So level 2 is the middle range of autism in terms of symptoms and severity. People with level 2 need more support than somebody with level 1, and they have more difficulties in social skills and are more noticeable to other people around them. So somebody with level 2 is more noticeable than with level 1. People with level 2 may or may not communicate verbally. They keep their conversations short or only to one specific topic. They might not make any eye contact as well and may not even express their emotions. Level 3 is the most severe on the spectrum. People with level 3 have very significant difficulties with communication and social skills. They have very repetitive behaviors, and many people with level 3 cannot communicate verbally or only use a handful of words. And what I've found to see is somebody with level 3 autism is that a parent or caregiver, such person holds up the alphabet, and person with level 3 autism points to the letters of the alphabet and they make sentences, and that's how they communicate. So people with level 3 ASD struggle very often with unexpected schedule changes. They struggle and have mental breakdowns, which, you know, ASD is a very hard disease. And they also have repetitive behaviors such as rocking or spinning things, or, you know, as such. People with level 3 require the most support to learn skills important to their everyday life. So the reason I chose ASD as my topic is because so many children and even adults are affected by this every single day. They struggle with some of the simplest things required to live. So growing up, I loved children at a young age. Even as a child, I loved kids smaller than me. But when my father remarried, I was so excited to have 15 nieces and nephews added to the family almost instantly. I adored these children, and they made me want to become a teacher. So after graduating high school, I decided to take a year off, and I wanted to become a nanny. And I applied to many jobs, and, you know, this one woman, she was a stay-at-home mom, but she was also pregnant with twins. She also had a 3-year-old. She hired me, and I was so excited, and I ended up having so much fun with this little 3-year-old. It made me miss my nieces and nephews that age. You know, through the months I was with this little boy, I knew something was a little off with him. He was about to be 4. He had very, very limited vocabulary. You know, he would point to the things he wanted, or he would grab me by my hand and, you know, like, try to communicate very, you know, it was hard for him to communicate. He also was very hyperactive and had a very short attention span. And he had many meltdowns for, you know, some of the smallest things. You know, me telling him to clean up his toys. You know, he couldn't really talk, so he didn't really express to me what he wanted. And so, you know, one night I just went home and I looked into what I thought this little boy could have, and I came across autism. I investigated it for a while because I didn't want to tell a mom, you know, I think your son has this if he didn't have it. So, you know, I kind of kept it for myself for a few months. But I was shocked to, you know, see how many symptoms he had on that were related to autism. So I talked to the mother because I knew something was wrong, and I feel like the sooner he got help, the sooner the better. So I spoke to the mom immediately, and she was very offended, and, you know, it kind of upset me. You know, a lot of kids go through this, it's nothing wrong. So basically, I talked to her for a while, sent her articles, and she decided to go get him looked at. And to her worst nightmare, he was diagnosed with autism. She was once again very, very upset. She was blaming herself, and, you know, I told her, you know, you can't blame yourself. It's not something that you have done. It's just something that's very common nowadays. And so, since he's gotten help, he is doing so great. He communicates so much better now with speech therapy, and I'm so happy to have mentioned this to his mother, and she is also very grateful that I mentioned it to her. You know, it was a hard thing to accept at first, but it's also a very common thing I kept telling myself, and no parent or caregiver or teacher or grandparent should be embarrassed, ashamed about this, because it happens. I'm just very happy he got the help I needed, just because I mentioned this, you know, to the mother. So one thing I was very shocked and I learned about was that autism is more prominent in boys than it is girls, as well as the symptoms and signs of autism ranging from very different things. And so some of the symptoms are hyperactivity, impulsivity, short attention span, aggression, causing self-injury, meltdowns, unusual eating and sleeping habits, unusual mood or emotional reactions, lack of fear or more fear than expected, and many more signs and symptoms. In conclusion, if you suspect or see any of these symptoms or signs of ASD in your child, someone you teach, grandkids, any child, please make it known, because a child who has autism really needs the help as soon as they can to help them better themselves as an adult in the future. So thank you for listening to my video, and I appreciate it.